Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about CPT changes for telehealth and audio-only visits. Back in 2024, it was finalized that there were going to be some new CPT codes for telehealth and audio-only visits. Some are brand new, while others are replacing old ones. So the old ones that were effective before 2025 are no longer acceptable at insurance companies, and they were replaced with these new ones that need to be used. I'm going to do a brief overview of these to bring awareness. However, I do have some things I want to talk about before we go into it. The first thing I want to talk about is the importance of making sure that you are checking your individual payer's billing and coverage policies when it comes to telemedicine and audio-only visits. I say this because after the pandemic and the PHE was lifted, all insurances kind of went their own way. Some of them require certain places of service to be billed in combination with modifiers. The modifier to be used depends on the insurance company. Not all of them follow CMS guidelines. Some of them have said you just use the place of service and you don't need a modifier. It's very important, and unfortunately, all payers are going to be different. Now, of course, you have your national payers like Aetna, Cigna, United Healthcare, but with Blue Cross Blue Shield Anthem plans, even though it's national, they all are governed, if you will, by location. So one state's requirements may be different than another's. You just have to check and verify, especially if you are billing across multiple different states where services are rendered. They no longer, to my knowledge, are their payers accepting place of service 11 with telehealth modifiers. That kind of went away when the public health emergency went away, and you have to follow each individual payer's guidelines, like I said. Also, not only does it matter how things are coded and place of service used, you also want to make sure that you're checking to make sure all of these CPT codes are even covered by the insurance. Not all insurances are covering certain CPT codes. For example, I know for certain that Aetna does not cover the audio only telephone conversation visits that other payers will. They say they don't cover it unless you have an authorization before the services are rendered. I'm not sure if they even approve many with an authorization. I've never had anyone try, to be honest with you, but that's a perfect example where maybe another insurance will cover it without any issue. However, we have Aetna who will not. So again, not only do you need to check your payer policies and guidelines for how to use the proper coding as far as modifiers and places of service on the claims, you need to make sure there's services and CPT codes that are covered and recognized in general. The CPT codes I'm going to be providing today are not on the 2025 CMS fee schedule. I looked it up and I put in the 2025 CMS fee schedule on the lookup screen on the CMS portal, and I put in the first CPT code of each of these categories, and none of them returned a national allowed amount, which tells me that Medicare is not going to pay for them right now. This is something that's very important because a lot of insurances will follow Medicare guidelines. Another reason and support for my argument that you need to be checking your payer guidelines when it comes to all CPT codes that you bill out, especially new ones that are released. And I do know that at the end of last year, when they were talking about finalizing everything, they were still kind of on the fence whether they were going to put a fee schedule together for these codes, and it looks like they did not. So maybe it will be next year, but for 2025, they are not. All right, so let's go ahead and jump into these. I wrote them down. Basically, the new CPT codes I'm going to be talking about right now are ones that are for E&M specific visits. So instead of using like a 99202, 203, 204, 205 for a new patient E&M with a telehealth modifier in place of service, they have now designated specific CPT codes for E&Ms that are done through telehealth. So for new patients, for televisits and audio, so the combination of video and audio, the codes are 98000 through 98003. So those are for the new patients. For established patients, E&Ms, it's going to be 98004 through 98007. I encourage you to look at the descriptions for these codes because it does specifically say how these are to be categorized or why they're supposed to be used in the description, as well as the time associated to them. So check that out, please, to make sure that your documentation supports what they're looking for if you were to get audited or need to send in medical records for whatever reason, and that you're billing appropriately. So those are for the synchronous audio visual telehealth visits, the new CPT codes that are for new patients, E&M, and established patient E&Ms. As far as how to use them, look at your payer policies, see if you need to use modifiers with those because they are only telehealth specific. So I don't know if they need modifiers. I'm assuming you probably still have to use the place of service that's appropriate, whether it's 2 or 10 for telehealth. But again, every insurance is going to be different. So if your insurance does cover these codes, you need to make sure you bill them correctly. And then lastly, the ones I want to talk about are the audio only. So the voice, like over the phone, and these are also separated by new patient and established visit. Although these are new CPT codes, they're replacing the old telehealth phone only, audio only code. So if you were billing this previously in 2024, you need to make sure your fee schedule removes the old ones and replaces them with these ones. And so 98008 through 98011 are for new patient audio only. And 98012 through 98015 are for established patient audio only. That little asterisk again next to these is that not all insurances cover audio only. You need to make sure your insurances do and that you don't require an authorization or a referral or something, some weird kind of niche for these to be covered if they will pay for them. Again, CMS does not have any fees on their fee schedule for 2025 for these codes. You can check it out yourself. I just did a quick search. I put in the 98000, 98004, 98008, and 98012. So like the lowest billed code of each section just to see, and none of them were on the CMS fee schedule. Again, check out the description so that you know which level to bill based off of the description of the CPT code, because the goal always is to send out accurate and clean claims to make sure that you get paid quickly. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.